It's Off Exit 10, presented by Capital District Sport and Fitness.
Cool. Let's roll. Thanks for doing this. Thanks for doing the reschedule.
Oh, yeah.
Jay, my shit's really loud. Usually, I know I'm usually high. Okay, that's much better. I was like, whoa, that sounds crazy loud.
Well, yeah. I didn't have this mic last time, though, right?
Yeah.
Because I had the fucking thing in front of my face. That's why I was confused when we were using them. I was like, what are these? But yeah, here we go.
We're good. We're doing it. No, thanks for the reschedule. And yeah, I think it's a good one to do. I mean, when did you guys start the Unconventional Collaborative?
I was pregnant. I think it was like September, October of 2023. Me and my colleague Danielle, she's a physician assistant. We'd been like texting back and forth for years. We actually connected on the internet because we were both stuck in this space between like conventional medicine and functional medicine, realizing that like both sides of the coin had really great things to offer, but most of the time it was like this all or nothing approach. No one's talking about this gray, messy middle. And so we kept texting each other, be like, I have this client who has blah, blah, blah. Like, what do you think? And so then she'd go text her friends and I go text my friends, and we'd like try to get down to the root of it, of like, why is this person not getting better? Or like, what resources can we give them? And at the same time, like I started meeting people like these guys, like, and we were just like, we can't be alone. There's all these people in private practice or in group settings who don't have resources but want to be collaborating. And not to mention, we just got past 2020, 2021, where people became more isolated, which also happened in the health space. It wasn't just individuals, it was trainers and coaches and dietitians and every aspect of health. So we were like, do you think there's other people who want this? And we're like, okay, if there's not, like, what's the harm in us starting something, right? Like, and it was very selfishly driven because the two of us just really wanted to connect with more people so we could improve our practices and improve how we were helping our clients.
I think it's great. When you say like the gray area, the messy middle, you're talking about like we have our classic Western medicine where we're just looking at body systems independently. And then what would be your far end of holistic, and then what brings you to this messy middle?
Well, I think sometimes functional looks at it as like never use a medicine, right? And a lot of times, a lot of these providers will do like a million bajillion supplements. Obviously, it's very scientific, but like they'll just throw supplements at the wall.
It's the most scientific term ever. A million bajillion.
Million bajillion. And I think sometimes they forget that like somebody might still need blood pressure medication. Right. Somebody still might need antidepressants. Like, and so it's this big extreme of almost like big pharma versus big wellness. And both can be true, right? Someone can need an antidepressant, but we could also utilize things like omega-3s or improving sleep, right? Test. Yeah, like a sleep test. Like,
we'll get into that. I'm so intrigued by all of that.
She's yeah. I think we're all intrigued by it. So that, but like that's really where we met.
Isolationist. Not isolation.
Yeah, and looking for root causes. Like, okay, but why did we get there? Because I feel like in conventional medicine, like, we see people too late. Like, they are having a big problem that maybe could have been slowed down or maybe could have been prevented. So that's a problem.
Yeah, and I think, too, as, like, I'm thinking of myself as a young, like, early 20s strength coach and trainer, you're like, oh, like, surgeries aren't necessary. I'm anti-surgery. And then you start training people and meeting them, and you go, oh, like, you have a spondy, you're having crazy radicular pain, we've tried these other interventions, like, and then you see these people get the surgery and you're like, oh wow, your function and quality of life has improved a ton. Sure, right, it is like this messy middle where I feel like that's our whole country and society, be in these extremes and be black and white with your thinking.
Yes.
I guess before we keep rolling, why don't you all just, so if people are, I guess, watching or listening, know who each of you are and what your backgrounds are. Because I think it's cool that you have this collaborative. When I lived in Boston, I felt like things were it was easier to be collaborative. I don't know if because it was just like there's so many colleges and facilities like this where people just work together more. I feel like here we all kind of function in our bubbles a little bit.
Not anymore.
Yeah, not anymore. We have this. So yeah, why don't start with Heather? Just kind of give what you do in your business, and then we'll get it rolling.
I'm Heather Tremblay-Croto, doctor of physical therapy.
Can we slide that mic a little closer, Heather? Just slide it right up as close as you can.
I own
There we go. Paul's got you.
Fern Physical Therapy. My background, sports orthopedics and pelvic floor.
Laura?
I'm Laura. Most people call me Sassy, and I'm a registered dietitian. I've been in the health space for, 12 plus years. I used to work with athletes and transitioned more to women's health, but I also end up helping a lot of men because the women are associated with them and they send them to me.
I'm Kristen. I am an unconventional dentist. I would say I still do treat some teeth, but I mostly help people with sleep apnea, sleep problems, breathing issues, and things like tongue ties and all kinds of things that are a little bit different. So that's how I kind of was connecting with them, because I was like, oh, they do things a little bit differently too.
Yeah, yes, Jay?
You do tongue ties?
I do.
You snip them?
I do. With a laser. No.
You
no
got one?
Yeah.
Oh, I wish you had a
do
mic
it.
right now, Jay. Speak.
Let's do it. We did like 6 yesterday.
I'll talk to you after.
We're not doing it right now, right?
Oh, that would be good content.
Let's clear off the desk. We'll lay it out right here.
We'll do the vagina talk later. Let's cut the time.
Let's do a tongue tie.
We'll go ahead and show.
Kristen, as I started reading about you, like people think about the dentist, like I'm gonna just go get my teeth cleaned or
I
get
just
a
went to the dentist.
or get a cavity filled. No cavities, Paul?
Nope.
Good job. Good job.
How'd you get into in dental school or after being like, oh, this is way more than just cleaning teeth? Like what's in my mouth and my teeth can affect other areas of my body, my airway and breathing.
So it started out, 8 years ago when I became a dentist, I was still interested in like why did you get cavities though? And I would be having these conversations with people like, is it diet? Is it acid reflux? What's happening? And we would kind of really work on that stuff together. And then I fell into this stuff because my own journey with sleep and breathing. I was exhausted, lightheaded, just like literally feeling like I was going to pass out in the middle of the workday, headaches all the time, anxiety through the roof. And I was like, something's wrong with me. But I would go to doctors and they're like, is it stress? Like, perhaps it's stress. Have you tried yoga? And I'm like, I know there's something wrong with me. Like, I feel like I can't breathe. Test after test, no answers. I happened to go to a dental sleep medicine course, literally because I wanted to visit my sister. And I went, and part of the course was learning how to read sleep tests, and they needed a volunteer. So I was like, sure, I'll take a sleep test, whatever. Took it, and they were like, you are not breathing. Like, you seriously need to see a doctor. Like, we can't diagnose you with anything, but something is wrong. And I was like, are you kidding me? I have been going to doctors for the last 2 years and nobody ever recommended a sleep test, which is funny now because I'm like, I'm so tired. Why is nobody recommending a sleep test? Yeah. But that's what happens, especially for women who look like me. Like, we don't look like we have a form of sleep apnea. So I fell into it because once I started literally treating myself, I was like, oh my God, life is a lot better when you can sleep and breathe. Like, who would have thought? And I was like, I cannot be the only one. Like, a lot of people must be struggling with this. And the more I started treating people and just kind of spreading awareness on it and getting more people tested and people are feeling really good, I was like, okay, I was right. I wasn't alone. So then that just kind of became my niche.
Did you work in, Heather, like a conventional, like insurance-based PT before you started Fern?
Yeah.
Yeah, like did you, Kristen, and probably you too, Heather, and Laura, were you hospitals before you did your thing?
Unfortunately.
Yeah, like maybe we talk just quickly, like to allow the three of you to really do what you want and help somebody, you had to break outside of what like the regular mold is of our Western medicine or insurance-based models. Like with dentistry, is that the same? Like were you at first learning these things, but like somebody's coming for a cleaning, I'm seeing these things, but I don't have the space or the time to address them.
Yeah, and it's also like people being like, I just want to hear about my teeth. Like, don't come talk to me about my sleep.
Right.
So I had to learn to be like, I can't care more than they do. I can just I can just tell them what I
well,
think.
Well, that's a big thing for all of us
it's
working.
Like, ooh, it's hard. So just like educating, putting the awareness out there, and then if people want to do something with it, fabulous. But it is hard, and that's why I'm really lucky. I have my own practice. I'm completely non-insurance based. I can do things the way I want, spend time with people the way I want, and I think we've all kind of been like, we need to step away from insurance models.
Yeah, Heather, you felt like that when you were treating people, like, oh my gosh, if I could spend the time to talk to them about this or spend longer kind of teaching them or cueing them with this exercise, like their outcomes would be much better.
Yeah, especially you're like, you got 6 people at a time. You're like, do 20 of those while I go focus on this person. And then you come back and you're like, you did 19 of those wrong. And then people are emotional and their pain comes from their experiences too. And you can't tease any of that out when you're watching somebody else do something or having to do manual with this person. And I got to a point where I'm like, I know that I can do better. And I feel like which is funny now because I take cash, but I felt like I was stealing their money by giving them really crap care. So I always say that too, like insurance-based PTs aren't bad. It's just their hands are tied. Like, they can be good therapists, but not have the time to honor their patient. And I get to do that now. I don't have to bill for that 15 minutes that it takes somebody to cry.
Right.
They can just let it out.
Yeah, I mean, that's important, especially with somebody who has had an injury that has caused, some psychological distress, or somebody in chronic pain. It's just building that trust is so important. I guess what all of you guys do, what all of us do, being able to have the space and time to do that is so important.
We share a lot of doozies.
We do. Yeah. Which I honestly think is something that connects all of us, is not only like we're all asking why, right? Like I think we have the time and capacity to ask why. We don't have to have insurance tell us why, right? Because they're usually wrong anyway.
When you say why is this person in pain? Why are they not making...
And then you dig deeper, not just like, oh, it's a cavity. It's a cavity, right? Like someone comes to me and they say my cycle is all messed up. I don't go, oh, well, here's the pill, right? I say, well, why? Like, has it always been this way? Was there a stressor? Like, are we having trouble getting pregnant, right? Like, it's the 5 whys and more. And then I also think kind of something that we've all been really good about, not good, I don't mean like good, like we're worthy, but like collaborating now. Like I have literally sections on my intake form that are meant to look at sleep and airway and to look at pelvic floor health, because I'm like, I obviously cannot do anything about it, but I can refer them. I can now look at this screening and say, oh, okay, yeah, they have chronic UTIs. I send them to Heather. I didn't know that a couple years ago. I'd learned it from her. Or, wow, they're snoring all the time. They have anxiety in the morning. I didn't know that could be contributing to sleep apnea or airway issues. And so it's also this collaborative approach. We're all asking better questions. And then we're not scared to be like, oh, you need to go see someone else, maybe before you even come back to me.
I think that's a tough thing in this field, I guess. If when you're younger and you get into it and you're like, oh, I need to start making money, or you open your own business and you're like, oh, here's somebody in front of me willing to pay me, I need money. And yeah, sometimes you put that first, right? But just learning, like, if I do the right thing, it's going to come back my way at some point, whether it's that person or it's karma and it's somebody else, or I sent somebody to Heather and in 2 months from now she's going to kick me a couple people back. Yeah, that's the collaborative.
I don't have a throwing cage like you.
No pitch. Oh yeah, no pitching cage.
No.
So there's no throwing it back, but you will politely like send them over to Laura.
No,
But okay, so if people come to you, or they're interested in the collaborative, like what are often practitioners? What are their issues? What are things they're usually struggling with, where they're like, I need some help with how I'm running my business or helping people?
I think a lot of people have told us they just feel like they're in a silo. And you look at conventional medicine and practitioners are in a silo. They're like, they're put there. You think about your GI doc, your OBGYN, your endocrinologist, right? You're going to them and it's literally like, okay, I'm seeing you for one system in the body. And so we feel isolated, not just from maybe you're a private practice owner with no other employees or colleagues, but you also feel isolated because you're like, who else do I ask about this? Like, I don't know how many times I've called a doctor's office and get no reply. Yeah. And that's really frustrating. And that's not even as a patient, right? That's like as a professional of like, hey, I have this question about this patient and nothing. Maybe I'll get the nurse if I'm lucky. And so I think a lot of people just say they feel isolated and they don't know what else they don't know. And so a really good practitioner knows that. A really good practitioner knows that they have to keep asking questions and they don't know everything. And so a lot of times that's where people are coming from. And then a lot of people just want to learn too. I think the good practitioners want to learn. The good coaches want to learn, right? We're forever students, not just scholars. So I feel like those are two big things. People want to learn and they don't want to be alone anymore.
Yeah, I think that's important. Yeah, that's where we're, fortunate here, like opening this. I brought on Dan, who was a friend from college right away, just knowing like with my anxiety levels, like I do not want to go through this thing alone. And having somebody else is important. So if somebody's not fortunate enough to have that at work, I think that's huge.
Well, and sometimes you just need the validation of like, hey, I'm thinking of doing this with someone. What do you think?
Yeah.
And like, it's not maybe like, that you're right intuitively, but then it's like, okay, but I need someone else to just be like, yeah, that's the approach I would take too.
Right.
And a lot of times that'll happen. Women in our group will say like, oh, what do you think? And I'm like, honestly, that's exactly what I would do. And sometimes with the healing journey of a lot of our clients, time is what we have to give them and say, listen, like, I understand that you want this fixed tomorrow. You want to be put on a pill and tomorrow feel better. I get that. But like, usually that's not the case, right? You didn't come to me last night, like your problems didn't start last night. So I think we've all also had these conversations ad nauseum about like, what's the person's stress like, and give them more time. Like, and if they're not willing to do that, then maybe they're not in the right place right now.
Yeah, I guess, okay, so like physiologically, let's say the three of you are sharing a client. Yeah, like what are big dots that you're wanting to start to connect? Whether they are not losing weight, they're tired, they're not liking how they feel, maybe they have an airway issue. Yeah, like where are we starting to connect things? We're looking at the nervous system and stress as a whole.
Yes.
I feel like we've all adapted like our intake forms so that we know what red flags might mean we should send them to a certain person. Like for you and other people, they've said like, oh, if they're getting morning headaches, morning anxiety, just certain red flags that are like, that might be a sleep issue, because a lot of people don't snore and don't know they have a sleep issue. I didn't know I had a sleep issue. So just knowing like, we can't figure out why you're not losing weight, but we haven't looked into the sleep part yet. Maybe that's what it is. Your hormones are all out of whack because you're not sleeping or whatever it is. And like for us, like we're sharing people where it's like, you have jaw pain. I've ruled out all of my things. I think maybe it's like a postural thing. Maybe it's something else that I'm not seeing that Heather can look at them with different set of eyes. So I feel like just knowing like there's something going on here. It's out of my scope, but at least I have a next step.
Right.
Especially being like pelvic floor, I feel like I see a lot of postpartum women, and there's a lot of talk about sleep because we're all extremely sleep deprived. But then we get gaslit a lot as moms because like you're a mom, you have a 1-year-old who doesn't sleep, and of course you're tired. But then I have that time to ask them the quality of sleep.
Right.
Are you also having jaw pain? And we know somatosensory system's connected to our neck and jaw and our pelvic floor because it's a part of your fight or flight. I'm gonna go in the poop direction, right? Because you don't wanna.
First poop mentioned.
Go there. Love it. Someone had to do it.
Should we start a tally?
When you're in the
Poopers and
wild
vaginas.
and you have to fight a bear, your body can't digest food.
Nope.
It can't chew food. It's got to be able to breathe, so it gets nice and tight, and you don't want to pee or poop, right? So you're going to either get rid of it or you're going to hold it in. And we're in a culture of that constant bear fighting all the time. So I screen all of that in terms of pelvic floor and jaw, and I have a cool business where I can go into the vagina. Here we go, tally 2.
It's 1-to-1.
I can also go into the mouth, so I can work on all of those things. And then I talk about what I've learned from Laura. Are you sitting and chewing your food 20 to 40 times? You know, can I help them the things that I've learned from Laura?
Is that what it's supposed to be, Laura?
Yes.
Yeah.
God, there's no way I do that.
No chance.
And then, you know,
that
what's
I do.
interesting,
Jordy?
the chewing also ties into jaw development.
Oh, there's so many.
It just goes round and round and round.
Like,
But this is
Mouth
good, though.
it
I mean, look how
fails.
holistically things are connecting from I'm in this
20
constant
to 40
state.
times?
yeah.
Holy-
I mean, we're not talking about like oatmeal, right?
well,
like,
I mean,
steak.
I don't know if
but
that,
a steak, a
A steak,
chicken.
though, still, Paul. I'm fucking...
It's yeah.
But that
It's
is
not 20
like-
to 40. I can tell you that.
we have challenges at night at dinner, and
can
my
chew the
husband's
most?
like 1, 2. He's like, it's the army. It was like 18 years ago, dude.
I feel like mine's just because I've always been on the go, so I'm just like constantly like half time I'm not even sitting down to eat.
I think I got
there's strike against
that. I think I got fucked up because when I was younger, like powerlifting, playing baseball, it's like if you eat fast, you'll trick your brain signals to eat more, and then I just chew really fast. I know, Laura.
pains me. But like going back to like how is it all connected, right? I always say that a lot of women come to me, and men obviously too, but I see mostly women. They're dysregulated and they're depleted, and those are the same two sides of the same coin, right? When someone is depleted of their nutrients, they're likely also been dysregulated. Like
You're talking hormonally dysregulated.
nervous system. So like if someone is dysregulated, what does that mean, right? They could be in fight or flight, or they could be in a freeze fawn. Obviously not necessarily my total wheelhouse, but I've learned so much over the years. I have a really good colleague who is a somatic experiencing practitioner in training. She's almost done. And she basically is like, you can't talk about food without talking about the nervous system. And you can't talk about nutrients without talking about it, because if someone is constantly in that fight or flight, like Heather was talking about, they're burning through their minerals. Sorry, my headphones keep falling down. They keep burning through minerals. Like we know that there's something called a magnesium burn rate. And if they're burning through their magnesium super fast, it's usually because they're in a chronic state of stress. And then if they don't have enough magnesium, right, they're probably tight and sore. They're not sleeping well. Like, you just start connecting all these dots. And that's what I always tell my clients too. I was like, one of my favorite things is to connect all these dots. I don't like keeping them in silos, because your jaw is not disconnected from your esophagus, which is not disconnected from your stomach. Like, it's all happening all at once. Like, we're sitting here blinking and breathing and we don't even notice that we're doing it. So I think that the dysregulation and depletion, they just go hand in hand, and they're often missed. Like, I can't tell you how many clients come to me after seeing a doctor and they're put on medication. Like, recently I just had someone put on Synthroid, which is a thyroid medication. Her TSH, which is all they checked, was normal, but she went in and she was tired and fatigued, and she was a mom of young kids. And I'm like, why'd they put you on this? And she's like, I don't know. And I start looking at her intake, and she's not even drinking 40 ounces of water. I'm like, the fact that someone didn't even think to look at the bare minimum, the basics, is like mind blowing to me, because here I am like asking a bajillion questions on my intake form so that I'm not missing these things. And the doctor said, oh, you're tired, we'll just give you Synthroid medication.
Is that what you feel like we do? Like, the things that we figure out with patients aren't really earth shattering.
No,
they're like,
they're
almost makes you feel like
It's like the
you're
sad part.
stupid.
Yeah.
Because you're like, okay, just drink more water, chew your food, sit down, and
Which is
stop
sad.
clenching
open your
butt.
mouth.
Yeah. But, like, nobody's talking about it. I mean, your doctors spend like, what, 5 minutes with you?
Yeah.
Yeah.
Do you feel like sometimes though clients want a more complex answer? They're like, is it
No.
really no?
No. They can't handle it.
Right.
And that's nothing against them, but like, it's not like they come to you and then they're put into a vacuum and they don't have to go home to their responsibilities. They need someone to actually crowd out all of that noise and say, actually, if you could just get 50 ounces of water today. And then all of a sudden they're like, oh, that worked. And then that gives them energy to do something else. And then they keep layering it, step by step until they start feeling it. And I think the person who wants the complexity doesn't realize that that's not actually what's going to help them succeed.
I don't know if this is because we all don't take insurance, but by the time they make it to us,
Right,
they're already so overwhelmed.
Good point, Heather.
And burnout, and
They've probably been in this silo for
they're just
too many
looking for
years.
any little thing to help them.
Like, I can think of somebody in our gym right now that would probably benefit from
Well, I think this
some
is
stuff
good too, because
outside of conventional.
because when we have a lot of the questions in here of like, oh, I've been training hard, my body's not feeling how I want, I'm tired, I'm fatigued, I'm not losing weight. Yeah, we see a lot of like pre-menopausal, menopausal women who that's the story. I've been to my doctor, they told me, whatever, try to be less stressed, work out more, and they're like, I'm doing all of these things.
Did you even ask?
Yeah.
Right.
Like,
And then I'm like, okay, close your mouth, breathe through your nose. And they're like, huh, everything just got better. And I'm like, okay.
The thing with
Again, simple.
the perimenopausal realm now is women are having babies later, right? Like the average age of birthing years is later, and if they're still lactating, they're in this like weird overlap of being postpartum, that early postpartum, lactating, and perimenopausal. So then trying to figure out the minerals, the hormones, the sleeping affects the hormones to your cortisol, your estrogen drives pelvic floor, estrogen drives so many different things.
Yeah.
Gut health. Like 80% of serotonin is made in the gut.
correct.
And how much does, like, Kristen, like a microbiome in your mouth affect your gut and
Oh my
vice
God.
versa?
Go to town,
So
Kristen.
Did I just open up a door?
Oh, yeah, be careful.
Let's
Like,
go. Doors opened.
So it sounds so simple, but people who have like chronic inflammation, cavities all the time, they're like, it's just in my mouth. What's the big deal?
Use fluoride.
Let's not even go there.
We'll open that door later.
That's a real
But
big
it's
door,
like,
Heather.
really big. But I'm like, okay, we're connected, right? Our head's connected to our bodies, I'm pretty sure. And you're swallowing that 2,000 times a day. Like, where do you think that bacteria is going? But it seems so simple, but nobody talks to you about this. So I'm like, if we can figure out how to get your gums under control, your cavities under control so you don't get new ones, because it's very possible, then you're also swallowing healthier bugs every day, 2,000 times a day. So there's a lot of factors that can kind of like flip the switch with oral microbiome, but it's not just brushing and flossing like people talk about. The biggest one is mouth breathing. That's what throws most people off, is the mouth breathing and having a dry environment, not being able to breathe out through your nose. That's usually the switch. Once we flip that, then they stop getting cavities. They stop having gum issues. They don't need to have surgery.
Like,
in their
that's
mouth.
never talked about.
Nobody
No.
talks about it. Yeah.
No.
Just don't
I
eat
know.
candy.
Yeah, and it's always like this shame thing, like, oh, it must have been something you were doing, something you were eating, you didn't brush enough. And I just feel like I see people who are doing such a good job with all that stuff, and I sip on coffee all day, every day. I love Sour Patch Kids. Like
The watermelon ones or the regular?
Yes,
Oh,
and the blue ones also.
Okay, watermelons are great.
But like,
Watermelon ones are crack.
that's not it. Like, if you have your candy, like, of course, don't listen. But if you have,
I'm not the food police. Listen, Sour Patch made both of my children.
yes,
Because when I was ill, that's all I could have.
yeah, me too. But I'm like, I just feel like there's this shame around like dental problems, and when you give people the control back of like, we can change a few things, and you can still have your vices or whatever it is, and like your life isn't over. It's like, oh, okay, I can do this. Like, I can have the power back, and I don't have to spend my life getting fillings.
I love when Kristen will talk about like ways to help with something like coffee drinking too. Like I've now told my clients, I'm like, if we're going to do Element, we're also going to make sure that you're swishing with water or you're using xylitol gum. And like the fact that like I'd never heard that in my 36 years of my life. And it's like the fact that that's, instead of shaming, she's educating.
Because that is helping taking care of the environment in the mouth and on the teeth.
It's not usually just the sugar, it's usually acidic things. So my biggest issue lately has been like chronic seltzer drinkers having a lot of problems because of the acid all day long. So if you neutralize it throughout the day with some sugar-free gum, xylitol is the best, it's going to neutralize the acid in your
Jordy,
mouth.
are you listening right now?
This guy chugs.
Seltzer drinkers.
Seltzer.
It's everybody does.
Because
And
what we want to have just this balance throughout the
little
day in our mouth
something.
of an acidic environment and an alkaline
yeah, it
environment.
neutralizes. So cavities only form when your pH in your mouth's like 5.5 or below. If you keep it up a little bit, you won't get cavities. So just chewing on gum, swishing with plain water. I did put my minerals in my water. You'd be so proud.
Oh, I have minerals too.
Oh my God.
Oh, look at this.
But it's like such a simple thing. Okay, chew on xylitol gum 3 to 5 times a day and I won't get cavities. Amazing. That's easy.
Yeah, but is that like part of our culture now too, where people are just snacking constantly and sipping
Yes.
constantly?
Yeah, because it's the 30 minutes after the exposure to the acid that you're vulnerable to get a cavity. So right after you have your coffee, right after you have your lunch, okay, just chew on gum for 3 minutes. That's all you need to do.
Interesting.
Yeah. If we're talking airways, like talk about if somebody is a mouth breather, like what is this cascade of negative effects, right? We talk about just having a more dry environment in the mouth, that affecting our microbiome in our mouth, but also from a nervous system standpoint, I think about in here, if somebody is using accessory muscles more to breathe, right, Heather? You have the scalenes and the SCMs and a pec minor, maybe a subclavian gets jacked up, and now we're restricting movement patterns potentially.
You can't use diaphragm. Diaphragm
Right.
can't flush out the gut. We can't lymph flow the pelvic floor.
Yeah. So like taking it back to like a super simple level, like the way we talked about when you were talking about like fight or flight, your body wants to breathe through your nose. The mouth is the backup system. If you're chronically breathing through your mouth, your body's like, what's happening? Why? Like, what's chasing me? What's happening? And so you have that chronic extra level of stress in your body. And that's why people who are mouth breathers tend to be high anxiety, just physiologically. It's not that they need medication. They just usually need to breathe through their nose. There are so many benefits to the nervous system, of course, when you breathe through the nose. But in terms of performance, I mean, 20% more oxygen when you breathe through your nose. I don't know if it was with you or with Danielle that I was talking about this, but when you breathe through your nose, you produce more nitric oxide. That's what gets the blood flowing through your body. Do you know what Viagra does? Like,
Yeah,
it it helps with the nitric oxide. I'm like, people going to their doctor just wanting pills, and I'm like, just close your mouth. Just breathe through your nose.
Done.
The Viagra or close your mouth?
I'm like, oh my gosh. But it does. It improves your performance in the gym and everywhere. So everywhere.
Well, it also helps control those hunger satiety hormones too.
Yeah.
Because people end up getting into that rest and digest state while they're sleeping, which is huge, and then prevents some of that snacking, right? Like it's just all connected. I think the more you look at the body, the more you realize that like we're all doing the same thing with a different lens.
Yeah.
And we're trying to fix similar problems with just different expertise, which is amazing.
But is it as simple as just close your mouth, breathe through your nose? What if somebody has whether it's their palate or whether it's just like their nasal cavity, their septum, like what if somebody has some type of restriction?
Yeah, so that's the most important thing first before everyone starts like taping their mouth shut to
Yeah,
sleep.
because mouth taping, right? That's a fucking thing now.
You gotta make sure you breathe through your nose first, please.
Are you in favor or no? Like some people probably do, and it's not safe because they can't get air in through the nose.
It can be a great tool. Is it the first thing you should do? No, you gotta make sure you can breathe through your nose first. So sometimes it's just like testing, like can I breathe through both nostrils? Do a sinus rinse, do some Xlear nasal spray. As you can breathe through your nose, as you practice it, you continue to be able to breathe through your nose better. It's like a use it or lose it type of thing. People who can't breathe through the nose, if they have a trach, it literally closes up. So the reverse is true too, which is cool. As you start to train yourself with that habit, it gets easier for you. So a lot of my people with tongue ties, for example, if their tongue is tied down, they're going to be breathing through their mouth. When your tongue can go up, it's easier. It's just habitually easier for your body. So there's little physiological things that we can work on with people to optimize and just make it easier. But sometimes it is habit building. Sometimes it is a few things you have to do at home. But usually it's really, we work on making things sustainable. So we try to do little things for a little bit to get you going. And then it's just easier for your body. The mouth tape, like for me, as somebody with a form of sleep apnea, oh my gosh, I couldn't tolerate it. It was so claustrophobic. Made sense. My body wasn't breathing.
Right.
But once I got better at it, once I could breathe through my nose, now I love it. But you have to do some work up first.
Would you have a standard? Like once you can breathe through your nose for this long, mouth tape probably safe.
Yeah, I would say 2 or 3 minutes. Like try a little, you don't need a lot. Like the ones that cover your whole mouth, I really don't like. Little tiny bit right in the middle, like postage stamp size is fine. It doesn't need to be super restrictive because I want your muscles to learn how to do it. Put it on while you're like making dinner or while you're watching a movie. Do you feel like you can't breathe? Where's your awareness? Is it making you think about it? If you can't tolerate that, okay, maybe not yet.
Right.
Do you bring those little things to shove up their
Oh my
nose?
God, I should have.
What do you have?
Oh,
I didn't even think of it.
What is it?
I almost texted you.
nasal dilators. Really, we're all looking real sexy going to bed now. Thanks for
Nasal dilators,
These
mouth
little
tape,
things that you shove
There's
up
like
your nose.
blue light glasses.
There's like
like
nose
these up my
strips,
nose.
but there's ones that go on the inside to open your nose. It works even better. You can use them for working out too. They have a variety of them. But that when you can breathe well through your nose, your sleep gets better.
The supplement industry is like the Wild West. The lack of regulations mean the supplements you purchase may not even contain the ingredients listed on the label, which is why I get my daily vitamins and supplements from Thorne. Thorne vitamins and supplements are made without compromise. Quality ingredients ensure your body optimally absorbs and digests your daily supplements, while in-house and third-party testing ensure you're getting exactly what you paid for. Thorne offers a variety of health tests reviewed by board-certified physicians that evaluate your lifestyle, gut health, sleep, stress hormones, and metabolic markers to determine which vitamins and supplements may be most effective in helping you feel and perform better throughout the day. For college and professional athletes, Thorne has NSF-certified supplements that make sure you won't get pop positive on a drug test. Whether you're an athlete, professional, parent, grandparent, or weekend warrior, Thorne's selection of high-quality supplements can help improve your quality of life. Switch to Thorne's high-quality and extensively tested supplements today at thorne.com/u/CDSF. That's thorne.com/u/CDSF. This episode of Off Exit 10 is brought to you by Bombas. Bombas makes my favorite pair of socks, hands down, alongside the most comfortable and durable underwear, t-shirts, and other everyday clothing staples. Their wide variety of sock lengths, colors, and patterns have you covered, whether you're working out, going out, or lounging at home. I love their merino wool blend athletic ankle sock for long days of coaching at CDSF and getting in workouts myself. And if I'm at home doing work around the house, you better believe I'm wearing my Bombas Sunday slippers with their comfy memory foam midsole. And when you buy from Bombas, you're also buying for those in need. For every item you purchase, Bombas donates one item to people in overnight shelters, transitional living facilities, rehab centers, Title I schools, and medical service professionals. Take my word, if you want to upgrade your sock game to one that's more comfortable, durable, fashionable, and charitable, head over to the Bombas link in this episode's description to browse their full collection of everyday wear, and don't forget to use code CDSF20 for 20% off your first order. Is a CPAP machine ever necessary for people if they're like
Yeah, absolutely. I would say for severe sleep apnea, that's still first-line treatment. For mild to moderate or people with other things like I have, an oral appliance, which is like a little specific type of night guard to keep your mouth or your airway open while you're sleeping, working on good nasal breathing. There's a bunch of different supportive things we can do, but I would say CPAP really only if you're severe. But even people who are severe, if they can't tolerate it, then we'll do something else.
Right.
Back to your thought about the septum, by the way.
Yeah.
It's like more of a functional situation because of how the jaw and the mouth is working. I can notice those things if I'm working on somebody's neck and they're laying on the table. I'm looking straight down at their face and I can see their nose doing funky things or their cheeks doing funky things or their jaw doing funky things. And then I can ask questions.
Yeah.
How are you sleeping? Do you have cavities? Do you have headaches?
Right.
Go see Kristen.
Yeah. Yeah. And the septum, like we all think, oh, well, if we just get the septum fixed, like that's everything. But if you still haven't trained your body how to breathe well, it's not going to do anything. And like, why did your septum get kinked up?
The why.
Is your is your palate like this? Because if we do orthodontics, if we do braces and flatten that out, it's going to straighten out. You don't need no surgery.
Right.
So that, again, just taking a step back and being like, but why did that happen then?
When somebody sees you for dentistry, so I'm so intrigued. We're just like going down this whole.
Yes. That was great.
Do they know what they're getting into with you looking at them in this different way than a regular dentist?
Most of my people, understand how I am.
Right.
And like, I also know the people who like want to get into this stuff. They want to get a salivary test. They want to get like figure everything out. And the people who are like, yeah, whatever. And I'm still going to tell you, like, I'm still going to tell you what I see. You can take it or leave it. But
salivary test, you're looking at what? Microbiome in their mouth.
Yeah. What's out of balance? What can we work on?
And then you're addressing it through what? Through food? Through
So it might be something as simple as like, let's do xylitol gum a few times a day.
Right.
Like sometimes it's literally just something like that to get the bacteria back in balance. Once we can see which pathogens are kind of running wild, then I can target those.
I think it's also symptom based, right?
Yeah,
because
for
if
sure.
someone is not having other symptoms outside of like cavities, granted, it's not saying that their gut health isn't in poor shape, but like she might be getting to them beforehand, right? Because like you said, like a lot of people are swallowing these pathogens and then it comes over to mean like if their stomach acid isn't robust enough, they can't fight it off. And after a while, the more and more you're in that fight or flight state or you're swallowing things you shouldn't be swallowing like constantly because your mouth didn't take care of it or your nose didn't take care of it, right? Like then all of a sudden they're having, I mean, it could be skin issues, it could be brain fog, it could be diarrhea, constipation, poop issues, right?
2 to 1.
That's the cool thing with like
this time.
with the testing, because I can work on like the mouth bacteria stuff, but there's a whole section of like gut impact stuff, and that's where I can put it out to the collaborative and be like, I have no idea what any of these bugs do or what they mean. Can somebody like chime in here?
Yeah.
And just I'm not going to treat that person for those things, but being like, this is the type of provider to look for, or this is the type of test you might need, is helpful. I mean, I had a situation with a family member who had been going to the doctor for 2 years for an issue and a pain. Within 2 minutes, they were like, it's his gallbladder. Like, I was like, okay, thanks. Like, that was so ridiculous. But that's the reality of how medicine is right now.
Well, you have to be so proactive when you're in our health system. I feel like we spoke about it on here. Like my wife has endometriosis, and just that over the years and trying to conceive, and it's like, oh gosh, if we weren't educated,
It takes 15 years for most women on average to get diagnosed with endometriosis.
which
It's a crime.
Which is terrible.
Yeah.
And it's sad because we've always said, like, what if we didn't work in healthcare? What if we weren't educated? What if we weren't outspoken people and we just kind of followed and listened to anything authority figures say? It's like, God, we probably wouldn't have a kid right now.
All three of us have similar stories, which is why, like, you become the practitioner you need, right?
Mm-hmm.
But, like, all three of us have a background where we could sit here and say, like, I know all these things, and I still had to fight like hell, and I still had to ask for validation.
Yeah.
Because I still feel gaslit.
Right.
It's sad. And it makes we fight harder for our patients because we know if we had to fight that hard for ourselves, what they're having to go through.
Right.
Right. People don't know the questions to ask and they just assume, oh, well, my doctor told me that, oh, you just have painful periods, like take birth control. Like that's the only solution. A lot of people say, okay, like, and I don't blame people because if I weren't in this, I mean, look at my husband, he's an engineer. And sometimes I tell him these things and he's like, what? Like he's a very, very well educated, very hardworking person. And that's not a slight on him, but like, that's just not his background.
Right.
And so then think about so many people who are not in this health space. They don't know the questions to ask and they don't know when they like need to ask for more help. And unfortunately, like Kristen said, doctors usually give us 5 minutes of their time. So the system is also broken. And so part of me doesn't even blame the doctor, but like all of us got out of the system. So like I think more practitioners need to fight to get out of the system and help people because what can you do in 5 minutes?
Yeah. I mean, I think I have a niece that's like just gone through so many different, like she's been in that silo essentially her entire life. And I'm like, just listening to the three of you, I'm like, maybe I need to reach out to my sister and be like, maybe she needs to go talk to one of you guys because a lot of it comes down to like food and like her digestive system or whether or not she can have like, we don't know if she has celiac, she might have celiac, like, and she's been tested so many different times. It's like,
Doctors don't run a full panel either.
Like how many times has she, like the amount of allergy tests that she's gone through, I'm like, how many times are you going to do this before you figure out what's going on? So like it just makes me think more and more of like she's been in that silo like that you said, and like I'd like to get her out of that.
Can you even, Laura, you just go to a regular primary appointment with an insurance bundle, is it possible to get the full blood panel that you would ideally
If you
want?
want to pay out of pocket, yes.
Right, you'd have to pay out of pocket.
Oh my God, this is a thorn in my side. I went to Massachusetts yesterday to get blood work done because New York State makes it impossible for us to get labs on our own. So
yeah, we texted about this, right? Because my wife was asking, I think, and you're like, New York is just going to be the end of me.
Oh, yeah.
Yeah, I mailed a test to my sister in Virginia.
Yes, I do this all the time. I'm mailing things out and then I'm mailing things from other states in.
Back to you.
Oh, I will find
ridiculous.
the loophole. But like, it's ridiculous. New York State is the hardest place to get out of like self-pay labs done. And like, so Danielle, my
Why
co-founder,
is that?
I think I was talking to someone, I think it's doctor driven. So
We
doctors
were talking
want-
about this.
Was it? Yeah.
Yesterday.
It's fine. It was yesterday.
She's like, it
Like,
was
I'm like,
yesterday.
didn't we just have this conversation?
Because it's the same for PT. We're so restricted here too.
Well, for how you can treat,
Yeah, we have to have referral from a doctor.
right? Yeah, like in Massachusetts when I worked there, PTs could dry needle. They can't in
I
New
want
York.
to dry
Oh, you were
needle
just talking
so
about that.
bad.
Yeah, you were.
I want to dry needle all the
I
things.
will gladly let you try
I want to dry needle the jaw and the vagina.
2 to 2.
Yeah, so it makes it hard. So back to your point, someone goes to their doctor and they say, I want a celiac panel run. The doctor and the powers that be, their admin, will go and say, okay, so there's like, I think there's like 2 or 3 markers they'll test for. A true celiac panel is, I think, 6 to 7 markers. And it's more of like a cascade, right? So like if one's negative, you kind of have to keep checking to see some of the other immunoglobulins and how they're interacting in the body. And so it's all code based, right? Like if you're not putting the right code in, you're not getting the right insurance kickback. And then you're not, if the problem is insurance says, oh, well, that first one was negative, so we don't need to test the rest.
Right.
They clearly don't have it. And if you push back, if you have a doctor who's willing, which there are doctors who are willing, I will give some of them credit, you end up spending like thousands of dollars on blood tests, which is like, just grinds my gears because I'm like, why are we charging this when it's literally the same tube of blood, the same phlebotomy draw? Like, just send it and test it all. But there are a lot of other services now. So like we were in other states, Rupa Labs is one that like my colleague Danielle will use. So she orders a ton of lab work for my clients who are not located in New York State. But I just used Function Health yesterday, which Mark Hyman is behind it, so I don't want to associate myself with him, but I will use these services to try to figure out how we can get more blood work done, because you go to your doctor and you get a CBC and a CMP and they tell you you're fine. And
Who's
you
he,
feel like shit.
Hyman? Why do I know that name? He's not the bulletproof guy, is he?
He's not the bulletproof guy.
Okay.
He is I think he's located in Massachusetts.
Yeah, he is.
He's got, the problem is that he's like, telling everyone that like live an unprocessed life or eat unprocessed. And then he has a whole line of supplements like that are processed. And I'm like, there's just like, he's like too much in the functional space now. So I think that there are some pros to him, but also a lot of cons. So I like to say I'm using the test, but I'm not necessarily his like biggest advocate. But I just got like for $500 a year, which still is cost prohibitive to some people, you get 3 blood draws, which is really reasonable. And it's looking at 100 biomarkers, which is also really reasonable. But most people can't access that, or most people don't even know what to do with that. But these, like, so Insight Tracker is another one. I used to work with them. Function Health is another one. They do have more information given to the person. So they get the blood work and then they have an online portal that kind of like explains like your RBC magnesium is low. Here's what you could do to improve it. Here's why you might see, X, Y, and Z happening. But back to your point, no, most doctors either won't order it because they don't know how to interpret it, or they won't order it because they know it's going to cost the person an arm and a leg. Like hundreds and thousands of dollars for three markers. Yeah.
The saliva test, the same deal? Hard to come by or no?
No, that's actually really easy. People can order it themselves. And that was something introduced from the collaborative because Danielle had a patient who took one and was like, can you help me translate this? And I was like, oh my God, this is so cool.
Kristen had me doing it.
And so now I'm like, everybody just spit in a tube. Let's go. Yeah, you can order one for yourself. Like I've been using Bristle. I'm not like affiliated or anything, but it's an easy one you can buy for yourself. The problem is that they kind of give you this printout of like all these bacteria and a bunch of products that you need, which you don't always need a lot of products. Sometimes it's just someone to help you like pick through and make a couple of changes. So sometimes people need help with the translation, but you can easily order one for yourself.
What are you commonly seeing in those? Do most people have a microbiome that is off, or probably acidic's not the way to put it, but that is off and has bad bacteria in it that you want?
I mean, I'm biased because the people I'm testing, there's some problem we're trying to fix.
Right.
So I haven't really been testing a lot of people who are like seemingly stable. Like the people I test, I'm like, why have you had burning mouth syndrome for months? Like, what is going on?
sounds
Or
terrible.
it is awful. Or like, why are you still getting cavities even though you're doing all the normal things? Or why are your gums like crazy red all the time? Like, what's going on? So usually there's some thing that I'm kind of trying to figure out. But you can, like, I tested myself. I tested like family members just to kind of have a baseline, and it will show you like, oh, you've got beneficial bacteria. Here's what you don't have, the cavity causing bugs. You know, it'll give you a good readout. It's really cool.
What no fluoride.
Or mouthwash.
I don't like mouthwash, number one. Yeah, because that'll kill a lot of the good bugs too, and that's what we need.
Is that like what the fluoride's doing too, overkilling a microbiome?
So it is antimicrobial, which nobody talks about, but it does make your teeth more acid resistant. That is undeniable. It does make your teeth more acid resistant, but it's not lack of fluoride that's causing the cavities. It's usually like, why is there so much acid in the mouth? What's happening? So like, I don't have a problem with fluoride topically. I'll use it here. I mean, I get samples of everything. I'll use it here and there. But I don't think personally we need to ingest it. I've never written a prescription for it in 8 years. But topically, I have no problem with people using it, especially like with your kids. As soon as they can kind of spit, do a little smear, brush, spit. That's fine. Do whatever you want to do. I will say personally, I buy like a hydroxyapatite toothpaste if I'm buying one for myself. But topically, I still think it has a place.
Because the hydroxyapatite, is that something that's naturally in our teeth?
Yeah.
Right.
Yeah.
And which is what? Doing a similar thing. Taking care of some of the acidity,
The
helping with the
mineralization.
strength of our teeth.
Yeah, because acid basically is demineralizing the enamel. So it's kind of helping us keep it mineralized and strong.
And we're just saying the fluoride is like an overkill.
I think ingesting it personally,
Right.
I do think, because it isn't living just in your mouth.
Right.
Like it's
Right.
going to your whole body.
Yeah.
And there's stuff now like it's in your bones. Like what's it doing there? Because it's,
It's a halogen, and so it can also compete with something like iodine.
yeah.
Right.
And like, so then you look at fertility rates are down, and a lot of women are deficient in iodine, and iodine increases fertility by like, I think over 50%. It's something wild. And so, right. It's like it's all connected once again of like, okay, yes, obviously we're trying to prevent some type of deficiency in like the larger society, but like at what cost?
Right.
Like it's,
Well,
And the
every
studies
action
aren't
causes
that
an action.
strong. It prevents like a quarter of a cavity. Like it's not like
And
I
it's
feel like
like
I'd rather
when-
work on other things.
And it's like, when did it start? When did we start using fluoride, putting it in our water? It was all based around teeth, right?
Yeah,
And
it was kind of by accident that they discovered it. And I think it's like 93% of the world that doesn't have fluoridated
I'm
water.
gonna say, like, anthropologically, you
It's
look
like-
at some of these indigenous countries
Yeah.
who don't have what we consider like great health in this country.
Yeah.
And they have no teeth issues. So again, it's going back. What are we eating?
Like it's more of our
How are
processed
we
diet,
eating it?
the lack
Yeah.
of chewing, and like all these
Stress.
things.
The
Yeah.
really
Yeah.
firm foods that you have to chew 40 times and how that's forming your jaw and forming your palate and
Yeah.
breastfeeding and what that does to your palate. And it's not the point is not adding fluoride to fix your cavity. Like that's not, you have a cavity, just use more fluoride toothpaste. That's not, it's not that you're anti-cavity. It's like you got to look at all the other things.
Yeah, I feel like it doesn't solve as much as we think it does.
Yeah.
So, and I have concerns about the side effects. So I would say,
well, especially if it's in our drinking water and ending up in our bones. It's and it's like funny, like health, like everything gets politicized now. Like we were talking about fluoride in here the other morning in the gym because there's a woman on Huberman that was good.
Stacy.
Yeah.
Yeah, she's really
Stacy.
good. Yeah.
Good. Yeah, I was talking to somebody about that. And they're like, oh, you're an RFK guy. I'm like, well, no, but like, just because I see the science or feel one take away about something doesn't mean that we'll like
Yeah, it's
all the
not
way in
black
this
or
camp.
white.
That's
Correct.
nothing thinking
Yeah.
once again.
Yeah.
And it's like
I
we
like to
can't
operate in
have
the
these
gray.
we can't have
Gray.
these conversations anymore without like
Right.
shades of
Like
gray
it turned
out there.
into that, and I was like, I'll just shut this down right now. Like I'm not going to continue on.
why.
Yeah, it's hard.
Yeah.
Yeah, it's a tough spot to be in. Yeah, it's crazy. So hydroxyapatite though, that toothpaste you can buy anywhere.
Yeah, there's tons of them. I use Boca personally.
Rise well.
We use Risewell.
Fig. There's a bunch of good ones. Actually, Dr. Stacy makes Fig. Feed Your Good Guys.
She's great.
There's a lot of
I
good
didn't know
ones.
that's what that stood for.
Feed Your Good Guys. Yeah, it's all about keeping the microbiome healthy. I like that too. But yeah, like my son loves the Boca one too. I mean,
Yeah, my son's both
So-
use the Rise well.
yeah.
No complaints there. He actually got a sample from his dentist, like a mint one, and he wanted to use it because it had like, fun design on it. He's 4. And he put it in his mouth. He's like, Mommy, this is spicy.
Oh, so cute.
Because the hydroxyapatite was like cake batter flavors. Yeah. He was like looking at me like, I'm like, you said you wanted to try it. I'm sorry.
And mouthwash is doing the same, just like this over.
So if it's an alcohol-based mouthwash, you're like drying everything out. You're wiping out a lot of the good bugs. But generally, a lot of the mouthwashes really, really just are not good for the microbiome. Because, they're killing some bad bugs, but they kill the good ones too, and then they can't win. So I would say generally people do better with just brush, floss. After you brush, spit, don't rinse it off. Just go to bed. Like keeping it really, really simple. We don't need like a 10-step
Because
routine.
the hydroxyapatite, we have it too at home, doesn't like have that like foam.
Yeah,
foaminess on the
one of
teeth.
the big things that we've
SLS.
changed recently, because I had read or
SLS.
heard not to rinse out.
Spit, yeah.
And I'm like, I'm like foaming at the mouth. How can I not? But then we switched toothpaste. I'm like, this makes way more sense now.
The sodium lauryl sulfate, SLS, is in like everything,
so bad.
and it's so bad, and it literally just creates that foamy feeling. But for people who chronically get like canker sores and stuff, you just take them off of anything with SLS and they never get them again. Like it's simple
Interesting.
stuff.
It's in
So
so
that's
many products too, not just mouth, like makeup, hair
Shampoos,
products, body wash, everything.
Yeah.
Yeah, I mean, we can get into the environmental factors of things, right? Just our
I'll go down a rabbit hole.
Yeah, but I feel like and if we're talking about the mouthwash and the toothpaste and switching to a hydroxyapatite, like beauty products, you're looking at that and what's in.
I am.
Yeah,
I'm crazy crunchy.
I love it. What are things you're looking at where you're like, I want to avoid this? Fragrances?
Yeah, I don't do any of that.
Yep.
We live in the middle of nowhere. We homestead a lot, can a lot, dry a lot, freeze a lot, live off land, mullein,
Dude,
sourdough,
I would love
kombucha.
I would love that. If I have a stressful, it's like technology that just drives me crazy. Something goes wrong, I'm like, this is about to waste 2 fucking hours of my life, and I know it.
Yep.
And I'm like, what? Paul sees me in the office just yelling at my computer.
If I see Mike like this in the office, I'm like, something technology went wrong.
But listen, we had a guy call the gym yesterday inquiring about the gym. And I just go,
this is sick.
And I just go, hey, just can I ask how you heard of us? And he goes, I'm embarrassed to say. What the fuck's he going to say? I go, just say, you can say it. And he goes, ChatGPT. And I go, holy crap, this is our first AI referral.
AI generated referral.
Look at that.
That's cool.
I said, what'd you prompt? He said, I just put in my injury history. I want a trainer that's going to keep me safe in Clifton Park.
I didn't know they could like give you.
I've heard that. That's really cool.
That is
wild.
really cool.
I love ChatGPT. It's my assistant for sure. I use it all the time.
I use it a lot
I've
too.
definitely started using it like in the last couple of months a lot more for just like offloading things that don't need to occupy my brain. So that way I can like actually use my brain for what I want to use it for.
Helps you not go down a rabbit hole.
Or it
Usually, or it sends you down one.
It can be dangerous.
It can definitely send you down a rabbit hole, but it just depends on what you're doing.
Wait, what do you use it for, Kristen?
Oh my God, so many things. Like I have my practice and it'll be like the dumbest thing where I'm like, I don't know what kind of cord this is, but it's not working. I'll take a picture of the end of it and it's like, oh, this is what you need to buy on Amazon. I'm like, amazing. Great. You just saved me a lot of time.
Yes.
Little things.
Yeah, saves time. We did it because we switched to video in this, and our last one was our first one, and we just couldn't get the files to download right. It would have taken me 45 minutes to Google how to do this, and ChatGPT, it was like 2 prompts, boom, here's our answer. Yeah, so it's good. Tech drives me crazy, but there's no avoiding it.
No, there's you have to adapt to it. That's what it comes down to, unfortunately, at this point. Or you can go live in the woods,
Like me.
Yeah, I'd love to.
Anytime, come visit.
You still hate the GLP-1s?
It's a great question. I hate how they're being used.
Okay, let's talk. Because we ranted about this last time.
Yeah.
And since then, we've had a few people in here who are on them. And for a couple, I've seen it almost like kickstart good habits. Like they lost some weight, they built some confidence enough to come in here, confidence enough to make some nutrition changes that has then helped. Almost like this domino effect. And I know not everybody uses them that way.
Correct.
So I feel like I've kind of swayed back to like, well, I guess if it's really going to long-term,
Yeah, listen, my stance has changed too. I think when they first were becoming more popular, I think I was very much like, what are we doing here? But I have seen them used appropriately, and I agree. I think, it's kind of like an antidepressant, right? Like, we have to dig into why is someone depressed, but sometimes someone needs that bridge in order to be able to like feel better so that they can cook themselves breakfast or they can go out for a walk, right? So I think that's what I'm seeing with this for same exact reason. It's almost like bridging the gap for these people who have like never been able to stick with anything or lose weight, or they have this constant food noise and they don't know how to get out of that loop. And finally, they're not having this food noise, so they can think about, oh, right, protein would be really helpful here. I can do that. So I think that there's a time and a place for it. The problem is that it's being overprescribed and under-supported. That's my biggest complaint, is that people are just being put on it at high levels with no plan of how to come off of it, and then no support about nutrition and lifestyle, et cetera. And so people are just being put on these medications, and like we know with any weight loss, whether it's with GLP-1 or just, by yourself, we will lose, and this, like we'll lose muscle mass, we'll lose lean body mass. And so I just had a client who she's on it. She has a family history of osteoporosis, which like, is that family history or is that just lifestyle based? Could be either, right? She also, her mom went through menopause early. She's in her 40s. So we're conscious of that. She's always had a low vitamin D. We're working on gut health, but I was like, we probably should get you to have a DEXA scan. She told her doctor laughed at her. And I was like, you're on a medication that could cause bone loss. You have a family history, like all that. It's not like I said, oh, just go get a DEXA scan for fun.
Right.
Like what? So I think that's the problem. It's just not being supported. And like a lot of these clients that get put on it, and yeah, they're losing weight, but they're losing like 2 to 3 pounds a week, which is increasing risk of that lean body mass, losing lean body mass, which is your muscle and your tissues and your bones. And then also like increased risk of gallbladder disease and all these other downstream effects from losing muscle or losing weight too fast. So there's all these complications that people aren't talking about. And then once again, this is where like insurance plays a role. Insurance is only allowing a therapeutic dose, which I believe the lowest dose is like 5 milligrams. Someone's allowed to start lower and build, but for a lot of people, they actually would do better on a microdose of something like 0.25 milligrams, because GLP-1 is something that you can actually produce yourself, and some people are just not producing it right. Why? Could be genetics, could be gut makeup, could be diet, lifestyle, stress, whatever.
We're producing where? Pancreas? Where are we producing?
I think it's our pancreas.
Okay. Yeah.
Don't quote me on it. I'm like, I think our gut, I think there's a probiotic. I don't know. I can look into that further. But I think that the problem is that once again, like we're relying on insurance to tell us what's appropriate. And so you're telling me that a 200-pound, 6-foot man, or I guess maybe that he'd be larger to need this, but like.
We hear Jordy in there.
Yeah. I was like,
let it out, Jay.
So you have a male, and then you're gonna tell the 5'4" female that she needs the same dose. Like It doesn't really add
Is that
up.
happening?
I don't know, but I mean it's a therapeutic dose, so you can't go any lower than 5 milligrams, or it won't be covered by insurance. And if it's not covered by insurance, people are having to pay $1,000 weekly out of pocket in order to afford them. So it's one of those things where once again it's being overprescribed to people who don't need it, or maybe don't eat. Like once again, a doctor's not asking the questions, right? Like if someone is truly putting in all the work, they're working out, they're eating well, they're doing all the things, and they're not losing weight, it could be really therapeutic for them. But if someone's coming in and they're not doing all the things, and they have the capacity to do so and the means to do so, why is this our first line of approach? Like, let's give it 6 months to a year to make sure they can actually do the things that are going to support it.
Yeah.
Because they don't have the time to do the counseling, and it's just like, well, this is faster.
I'm seeing it a lot in the postpartum world with people trying to use it for like that last 10 pounds of baby weight. It happens a lot. It does. A lot. And they're being told to eat 1,200 calories on a GLP-1.
Jesus.
And they're less than anywhere between 1 and 2 years of being postpartum.
Who's telling them to eat so little?
They're physicians.
MyFitnessPal, physicians, their trainers. Like,
fucking macro counting. We still hate macro counting. Macro coaches,
you can just
maybe
see
I
her
should say.
face just like contort.
I love them. You'll see them, like people come on and talk about it, like, oh yeah, we make sure women are fed, and then I'm like looking like what they're telling people to eat, and I was like, 1,200 calories is not fed. 1,600 calories is not fed.
No.
I mean, like, it's wild.
Well, I think when you were on last, because my mom is on one of the GLP ones, and she's she was pre-diabetic. She has Hashimoto's, and she's gone through every single thing that you like, years and years and years of like trying everything you could, and then her doctor's very good, and like she has told me I need to schedule a doctor's appointment. I'm sorry,
Paul, schedule your doctor's
I
appointment.
need to schedule a doctor's appointment with her, but she was like, when you schedule it, just plan extra time because she is going to take extra time to make sure she answers.
I'm gonna need the
That's
asks
great,
all those
doctor.
questions.
Yeah, that's great.
So she's gone through all these things to try to help her lose some weight, and then she finally, she had taken some tests and her A1C was high, and we have a history of diabetes in our family. So she was like, all right, we're going to put you on this. And then she saw such a crazy difference, both in her energy, how she feels, but my mom also is somebody that's a psycho when it comes to working out.
Oh, she's here twice a week,
She's
gets
here twice
after
a
it.
week. She plays pickleball like 4 hours a day, every fucking day. She's also like 68 years old. So like this woman is going constantly. So I knew for her, like she's a person where I was like, okay, like because at first when she said she was doing it, I was also skeptical. And then again, I operate in that gray area. I like to be in that gray area, and there's definitely people that I think will benefit from it or jumpstart them into
I think
some
we're
good
lucky
habits.
too, because if somebody comes to see us, it's like they're being proactive about their health.
Mm-hmm.
They probably have a degree of education about what's best for them to kind of seek us out in the first place. So I think we kind of live in a bubble in terms of that realm. Not seeing people who are like, oh, I just want to take this just to lose weight. I'm going to still sit on my couch, so I'm not going to do much.
Right.
But here's the other thing about all of us as practitioners, right? When these people come in on these things or asking questions, none of us are like, I agree or I don't agree.
Right.
We take the time, our own personal time, to ask other people, to run down rabbit holes, to do the research so we understand it so that we can come back and treat our patients better.
I think that's a good just thing to say for anybody. Like, okay, I went to this doctor's appointment. How long did they talk to you for? How much did they listen to you? And I think getting that answer is probably going to tell you a lot about the quality of care that's to come.
For sure. I mean, if they spend 5 minutes with you, how much are they really learning? Or how much are they really diving into what's going on?
Do we know what the average time one-on-one with the doctor? I know in PT world, I think the last time I checked, it was 8 minutes one-on-one.
I think it's still
the
like
average
5 to
time.
10 minutes for
I don't know
primary.
that, but
Yeah.
I mean, it can't be more than 10 minutes.
But I know in my world, like if I see someone for an exam and I literally have 5 minutes, I'll be like, you are coming back. Like I can tell you right now there's no cavities, but we need to talk more. And like, okay, you're coming back for another appointment. That's fair. I would want to know that if my doctor was like, I don't have time right now because it'll take it away from somebody else, but you need to come back.
You can do that with your physician too.
Yeah.
Like if you go to a physical, and usually physicals aren't that long, and like they go through your checklist and you're like, do all the screens and everything is great, and you feel unsatisfied, you can call back and say, I need a follow-up visit. I don't want to wait another year. I need to discuss this more. Or my blood work comes back, they call you, everything's great. You send it to Laura. Laura's like, yeah, it's in the normal, but it's the low normal. Then you're like, all right, I'm going to call that person back in. I want another visit because I want to discuss that thing.
Right.
Like you have a right to do that. You'll
Be
pay
your
your
own
copay.
advocate.
Yeah.
Be
Like
your
your
own-
physical is free, you'll pay a copay, but it's worth your time.
A couple of years ago, I got a letter from my doctor before my physical and it was like, just so you know, you can ask one question.
Seriously?
Wait, for real?
This really happened. This was a few years ago. My doctor was in Latham and it was like, you can ask one question or otherwise you need another appointment. I was like, what?
The point.
For my physical? I'm like, for the whole body, I can talk about one thing? Yeah, no, that really happened.
Wow.
Did you switch?
Yes, I did.
Actually, I got in the parking lot and immediately called him to the doctor.
I was like, oh my God, okay. Wow. Yeah, that happened. Yeah, I should have saved it.
Wow.
Mm-hmm.
That's
I wish you had like a body cam on for that.
Oh my God.
That's insane.
This episode of Off Exit 10 is brought to you by Anchor and the all-new Anchor Pro, crafted to endure the most high-performance workouts without the high cost and space requirements of a standard cable machine. Named the best portable cable machine by Men's Health Home Gym Awards, Anchor provides the full functionality of a cable machine in one small space-saving unit. Designed with user-friendliness in mind, Anchor can simply be attached to any squat rack or placed on any wall in your home gym using its intuitive sliding track mount. With up to 65 pounds of resistance, Anchor is built for high speed and controlled exercises alike, from cable presses and rows to chops and lifts. The Anchor has been a game changer for us here at CDSF, and now you can enjoy the same professional quality cable machine in your own home gym by heading over to anchortraining.com and using code CDSF10 for 10% off your order today. Get all the benefits of a cable machine without the high cost and installation fees. Enjoy the portable luxury and space-saving performance of Anchor today by going to anchortraining.com and using code code CDSF10 at checkout. That's anchortraining.com, promo code CDSF10 for 10% off your order today. This episode of Off Exit 10 is brought to you by Drink Alchemy. Fatigue and brain fog affect us all, destroying everything we pursue. Whether as an athlete, artist, creator, or entrepreneur, our mind holds the key to performing optimally. By combining the most potent organic nootropics found in nature, Drink Alchemy delivers sustainable boost to creativity, memory, energy, and focus in one epic beverage. Stop pumping your body full of excessive amounts of caffeine and unknown proprietary blends from other energy drinks, and get clean energy from Drink Alchemy's natural nootropics like lion's mane, L-theanine, and caffeine from green tea. Used by Olympians, D1 athletes, MMA fighters, and entrepreneurs, Drink Alchemy has become a huge part of my daily routine, making sure I'm functioning optimally during long days of coaching athletes, running CDSF, and getting in quality workouts myself. So do yourself a favor and ditch the energy drinks loaded with caffeine, other stimulants, and who knows what else, and head over to drinkalchemy.com today. Live with your mind unbound and save 10% off your order by using code CDSF at checkout. That's drinkalchemy.com, promo code CDSF for 10% off your order today. Yeah, that's crazy. Yeah, it's just cool that you all have similar questions in your intake now that like spark your brain to be like, okay, oh, this could be a nutrition thing, or this could be like, what's something, Kristen, you've added to your intake since joining the collaborative?
I feel like, I don't know why this comes to mind, but I feel like acid reflux comes up a lot with my patients as it is. And I see it from a very functional perspective. Like, oh, if your tongue can't get up or you're not breathing well, of course you're going to have like reflux up of the acid. But I'm like, if I look at somebody and it's not that, then I'm like, ooh, maybe Laura would know. And people post about that, I feel like, a lot in the group. And that's been like a big one for me. That's been a red flag of like, okay, I've looked at my possibilities, but maybe it's something else. So that's been a big one that I've looked into more for people.
That actual example is amazing, because if could be airway, right? Could also be airway, and then because they were a mouth breather turn into H. pylori. Could also be because they're not eliminating correctly. They're not pooping. There it is again, right? And maybe it's from lack of fiber, but it could also be positional. I send a lot of my constipated clients now to a pelvic floor PT who has education in that, because it could be that they're not drinking enough water. They're not like you can just send it right back, right? Are they sleeping well? Are they eating well? And it's all connected. And like, if things aren't functioning from head to toe well, like, it's gonna come back in some way, shape, or form. Like, there's that whole concept of the body keeps the score, right? It's gonna come out in different ways in different people.
Yeah. I mean, yeah, right. You go from the airway to the gut, and then we're thinking about pelvic floor. Heather, when people see you, when you talk positional in terms of the pelvic floor, you're thinking what? Just like an anterior, posterior? You're thinking, go, give it to me.
I don't even really look at anterior, posterior tilt anymore. I mean, everybody has like a different posture. Of course, if you're talking postpartum, then you're just going to have like a really big anterior tilt. I look more, you're like in terms of like eliminating?
Or just like what's impacting the musculature of your pelvic floor and how...
You just opened
up.
Opened the door. You opened up a huge door.
I mean, like, who are we talking about? Athletes? Are we talking about runners, CrossFitters? Are we talking about pregnant women, postpartum women? Are we talking about men? Are we talking about cyclists? You know,
right?
That all those answers can be so different. And I think my background as being like a sports orthopedic PT really drives those deeper questions for me. It's not just a hammock of pelvic floor muscles.
Right.
It's looking at their hip, and we don't even really call it a hammock anymore. It's a trampoline.
Oh,
yeah.
All right.
I'm learning a lot.
I like a good visual, honestly.
Yeah.
So yeah, I'm queen of analogy.
Same.
I know.
I think that's how it's
like
the best way
motions.
to educate people.
I know.
How'd you get into pelvic floor PT? Because you started as doing like more sports, more ortho PT.
Yeah. So my first two jobs were regular sports outpatient clinics, like total knees, ACLs, spine, disc, all the things. And then I got pregnant, and I had an okay birth, and I had an okay recovery. But being somebody who liked to do Olympic lifting and liked to do boxing, and seeing more women, like, you just draw people who like are in the phase of life you're in.
Mm-hmm.
And seeing them orthopedically and thinking, God, they're like so underserved. These people who want to get back to movement are so underserved, because there's not really a gap bridge between sports PTs
Right.
and pelvic floor PTs. There's no one like living in that middle space of like the intensity that you need to get back to your sport. So then I just dove in, but it was in 2020. And so the coursework that I needed to do internal kept getting rescheduled. And then 2 years of self-studying and then jumped right in.
So you'll blend doing internal, like manual work, and exercise in terms of treating a pelvic floor.
All of it. I do a whole ortho screen, and if the patient consents and they're willing to have an internal exam, then yeah, we'll do that.
Right.
I see her for both.
You just throw yourself out there.
I'm like, yeah, absolutely. I see both of them, actually. I wouldn't trust anyone else. Like, she asked me if I can use a laser. I'm like, absolutely. She asked me if she can, do whatever. I'm like, I don't care.
Within 2 seconds, we're just like, okay, laser. She didn't even know what I was doing.
I was like, sure. Why
I
not?
trust both of them
So
wholeheartedly.
you're their guinea pig.
Yeah.
I don't know, but I will gladly be.
Wait, what do you mean laser?
Well,
I didn't mean to switch.
yes, we can get back. Basically, I can use a laser to tighten up. So, okay. So some people snore because it's their nose. Some people snore because it's their soft palate, like that thing in the back of your throat. If you can't see down it, we can literally lift and tighten it with a laser. It basically like gets the collagen to like contract and tighten up, just like how dermatologists can use a laser for like a facial or wrinkles or whatever. We can use it on the soft palate to tighten it up so there's better airflow and you don't snore.
So you're just blasting a laser into somebody's mouth.
You don't really. Well, your experience. Did you feel it?
Nothing.
Yeah,
I mean, like, I could tell she was doing something.
but it takes like a minute and a half. It's like
Yeah.
she's had 2 babies. That was nothing.
No, this one hurts me more. Way more. We didn't even do pelvic floor yesterday.
No, I just gave you ab exercises.
Heather did have a slight grin on her face as you said that, so
Are there going to be more dentists that treat like you in
I'm
the
trying.
future?
I'm hosting a retreat in the summer to try to train more dentists. It's going to be a very non-traditional, like we're doing yoga / learning airway stuff.
Yeah.
But yeah, people are curious because once your eyeballs get open to this stuff, you see it everywhere, and you're like, oh my God, you've been grinding your teeth down to nubbins because you can't breathe. It's not because you're just stressed, like it was like we were always told. And once you see these things, you can't unsee the patterns in people.
It's not about just throwing on a mouth guard.
Yeah, it's just a helmet for your teeth. It's not doing anything. It literally is. It's like if you were banging your head against the wall and I'm like, here's a helmet. But I didn't ask you why you're banging your head against the wall.
You're talking about
That is
like a
great.
night guard to
Yes,
sleep.
yes. And that's everybody's solution, but it doesn't fix anything.
Because you're grinding down because trouble with your airway.
Yeah.
And listen, all of that drives mental health too. So
Oh my God,
part of the
it's
reason
a
why
whole-
I dove into this was because I had issues with my son and, behavioral issues and anxiety issues. And he was like horrible cavities. I said to his dentist one day, I'm like, you're fixing this cavity. He's got like 12 cavities. He's only like 7. There's like maybe a behavioral perspective to this with like airway and sleep and oral function. She's like, yeah.
But no.
Okay, can I go see someone? I don't know. I don't know. I'm like,
Yeah.
all right, well, I'm gonna go see someone. But like, she knew, but she didn't
People
know
are
to ask.
starting to know the links, but not knowing where to go. Like in kids, ADHD looks like a sleep deprived kid, and a lot of kids get put on ADHD medication when they simply need to breathe better. And once
Yeah.
we can get them breathing and sleeping better, they don't need medication.
Well, at what age does some of this start, and what can
Very early.
In the womb.
yeah.
and what are things that these are genetic predispositions because of somebody's anatomy?
Yeah, sometimes it's that they have a tongue tie. Sometimes it's they can't breathe through their nose because they're allergic to the family dog. Or, who knows why they can't breathe through their nose or
Pacifiers,
pacifiers. I mean,
bottles.
it depends, but sometimes it's something environmental or something habitual. Sometimes it's their anatomy, something they're just predisposed to. It could be a variety of things, but once we figure out the thing, if we can save a kid from a lifetime of medication, amazing.
Or trauma from stress. of
Yeah.
People telling them they're horrible.
Yeah, so many things.
Yeah, that's the dream point. I think, probably ADHD. Just think if any of us, you get poor sleep or poor quality sleep. Like, think about that cascade.
Mom brain,
It's a real thing.
Yeah.
Very real.
lack of sleep.
Yeah.
Yep.
Yeah, we just got rid of pacifier 2 weeks ago.
Good job,
And like
good
2-year
job.
molars coming in. But yeah, I mean, it's like, shit's hard.
Yes.
But it's harder to fix as adults that's
Yeah.
where like Kristen lives.
That's my problem is because I treat adults and I see all the people I wish had intervention.
Well, does that go for all of us nutritionally? Oh my gosh, if I go back 20 years and you didn't crush these sodas and snacks every day, or oh my gosh, if you maybe didn't train like a power lifter for this many years, right?
Kids being put on supportive shoes with insoles because they have flat feet.
Yeah, you have that. We see a lot of now, which is like good. A lot of high schools have lifting programs now within the school, which is like cool. Let's give kids opportunity to strength train. We know all the benefits of that. Kids that can't afford to come in here have the chances too, which is awesome. But a lot of them are run like powerlifting style programs. So like the number of spondies or discs we see in like teenagers from, I was squatting and deadlifting heavy at school. You're like,
they're injury creating programs,
They're
not injury
also not
prevention
recovering
programs.
appropriately. They're drinking prime drinks thinking they're getting enough electrolytes.
The energy drinks is crazy. I started working in this field in about 2010, 2011, and wasn't a thing. And now, like, go into our recycling bin, and it is just filled with C4s and ghosts and bangs.
Which then comes back to sleep, right? And also, what else? They're on their phone.
Yeah.
Right? We're in this phone-based society where kids are on their phone far more. We had this whole discussion. We do once a month in the collaborative, we do a collab and connect call where we just get on and we all kind of like talk about whatever topics. We went down the IVF rabbit hole and then we went on a phone rampage of just kind of just understanding. Like we obviously, like you said, can't get away from technology, but how much is that impacting not only our mental health, but our physical health?
Neck and jaw.
Yeah. I mean,
yeah.
Wait, did you... Dr.
Like, why is
Julia told us there's now a new setting on your phone.
That what?
It's called screen distance.
Whoa.
So
What's it do?
It's really cool. I actually put it on because she told me about this yesterday. And anytime the phone's too close, it literally will stop. Like you can't do anything until you move it away. And I was like, wow.
Oh.
Like it literally like changed my pattern. I'm like, yeah, I am like.
Did you
really,
turn it on?
Yeah. It's on like settings, screen
cool.
time, and then turn it on. Yeah, it's really cool.
But like talking before about how sometimes it's such a simple solution, like drink water. Like someone's coming to one of us for like neck or jaw pain, and we're like, okay, but
Bring the phone up
yeah,
here.
like sometimes it's not that you have some crazy thing we need to fix.
Right.
Like slapping a mouth guard isn't going to help them. Just okay. Yeah. Sometimes it's simple stuff.
Sometimes it isn't.
yeah.
Sometimes it is like some of our shared.
It's definitely not. It's very complex.
Some jaw people turn into pelvic floor people
Yeah.
unintentionally.
Yeah.
Yeah.
Do they ever go back? Like if they come from jaw to the pelvic floor, back to the jaw?
Oh, we've been all
We're
round
bouncing.
and
We're
round.
bouncing.
It's like a trampoline.
What's really interesting, something that I don't know, it just like within the collective we learned too. Like I see a lot of endo patients, and endometriosis goes hand in hand with POTS, with Ehlers-Danlos, with
MCAS.
midline tissue disorder, which is tongue tie and lip tie. It literally goes round and round. It's so crazy.
Yeah, we have a lot of rabbit holes.
Yeah.
Yeah, but that's why integrating is so important. It's just like in our current medical system, it's like not the consumer, your average person. That's not a thought. I have my what you need specialists are needed.
Sure.
They're needed, but to be able to integrate.
And I think a lot of these practitioners also struggle with who to refer to. So I sometimes have to give them credit too. Like it's like kind of like you said with the dentist. It's almost like they know. It's like they're starting to know, but then like, okay, but
But where do I?
Then you're
where?
stuck.
Yeah, they're like,
And that's
okay,
what it's been really helpful with the collab.
Yeah.
So I'm like, I know you need help, but I don't even know like
who?
where to go.
Yeah.
It used to be better, I feel like, in this area. I don't know if it's just like now that I'm cash and by myself or post-COVID, but I feel like I used to have lots of relationships with doctors and other practitioners, and it's just like,
Here's a weird area.
it's just not anymore. I can't get a hold of anybody. I have
get a hold
like
of
two
anyone.
people
That's
I
what I
can
got.
call and be like, this person needs this MRI. And they're like, yeah, send them. I have like two of those.
Well, that's the other problem with being New York State based is like if you could just order imaging, if I could just order labs, we can skip that step.
I
too.
know.
Yeah.
Is that a New York thing too?
We cannot order imaging in
A
New York
PT
State.
cannot. Yeah, and it's like
We're
you're
trained to. That's why we're doctors.
right.
We're also trained to possibly prescribe medication, but I don't want that.
I don't want that responsibility.
I don't want that. I'd like to order an MRI though.
Yes.
No. Do you ever think you all have kids, right?
Yes.
Like how, right? Because our daughter's 2, and it's like we're in this world. I just, we're in the youth sports world, and I just see how crazy it's getting
I'm
with
nervous about that.
Yeah, me too.
the demands of every team, right? Like if you play a travel team, high demand of your time and of your body. And now high schools, I feel like, are starting to match that. Just whether it's competing with the travel team or they just feel like they're able to do more. But it's just a crazy world that we see like either forced specialization young, cause overuse injuries, cause psychological burnout. And also we're around Shen, which is just like a gigantic school. So it's like you got that many kids in the same amount of spots on a team.
'Cause I'd say, I mean, obviously it's big at getting like that everywhere, but you know, I think school size does make a difference too.
So I graduated from Shen, and it's why we moved to the middle of nowhere.
We bought our house in Burnt Hills because when we first moved back from Boston to here, we moved in with my in-laws and then just got to meet families. I got to kind of see everything. Like when I worked in Boston, there were some big high schools in the suburbs that I worked with. It was like very political, very competitive at young ages. And I go, hopefully it's probably not going to be like that when I go back to New York. And I was like, I'm wrong. It is. But yeah, we bought in Burnt Hills for like that same reason.
I mean, our school, I don't think they start sports until like 14, 13.
Like
school,
organized.
School sports,
Yeah.
yeah. There's like t-ball. We have to go to the next town over for soccer. That's it.
Yeah.
Which is kind of cool.
And I think of like, you know, my niece goes to Ravenna, smaller school, like probably around the same size as like Burnt Hills. Also, my sister just doesn't care about conventional things. So she just will stick to her guns and say we don't need to do all of this, and would rather her experience multiple things. So like my niece does theater, she loves soccer, she plays basketball, and if it's too much, my sister's like, okay, let's just take a break right now, we'll go do something else. And I think because of the fact that it's Ravenna, the school's smaller, like there's not that like fear of I don't go do this, I'm not going to get a chance to be on this team.
Mm-hmm.
And like that's what I see with like a lot of the really big schools is like, if I don't participate in this extracurricular thing that isn't mandatory, but it feels mandatory. And that's
Gives
the
you
problem,
bonus
I think.
points.
So
Well, I think I just read The Anxious Generation amongst like 5 other books about kind of these concepts about kids. We went from like this play-based way of parenting to a fear-based way of parenting. And it also includes this, it's like a phone-based way of parenting as well. So it's like, it's talking about how a lot of kids would benefit from not having a phone, but it's hard because as a parent, you're like the only person saying this. So then like your kid is now going to be ostracized because they don't have a phone. I feel like it's the same line. And, but
there's
at
a
some
few kids in here
point,
that don't have phones, and it's
amazing.
it's amazing. I'm like, wait, you don't have a phone?
Are the kids that don't have an Instagram? You go,
Maybe.
they're in high
yeah.
school, you go, yo, good for you.
My niece is in 8th grade, doesn't have an Instagram.
Yeah, you're like, good for
so,
you.
yeah,
Because I was going to shame her today for leaving her program out. And I was like, I can't even tag you on Instagram. God damn it.
I mean, so like think of what it does to our brain. Like, what is it doing it to a developing brain?
There's a
I
lot
know.
more research on this now.
Yeah.
Like age 18 is ideal.
Yeah.
Like my son asked me, when do I
Gonna
get
put
a
it off
phone?
as long
When
as
you turn
possible.
18.
Yeah. Yeah, just think about social media and us as adults probably having to work to not compare ourselves to other people. Imagine a teenager, a developing brain.
I feel
Yeah.
like that's half the conversations we'd have in here with kids a lot of times. Like, you don't need to compare yourself to the kid. Like, because when we grew up, all of us, we didn't get to see the kid in California unless they were like on TV and whatnot.
You'd
And
see
it's
the
like,
Olympics.
Yeah.
Like
and
that's
you're
really
like, oh, okay, cool.
marker.
But like you weren't comparing yourself to the person that you were playing against. Like that was it.
Yeah.
Like as opposed to like, oh, I can see, LeBron James's kid across the country like doing whatever he's doing. Like, yeah, well, that's not you're not him or her or whoever it is, and it's tough. But I feel like we're navigating those conversations a lot of just trying to have kids manage those expectations of not comparing themselves to the people on there, and you hope some of it sticks. It's not all going to, but
Well, it starts with the family, right? Like I think we have to talk about my clients all the time of like they come in and they're like, oh, well, I saw on social media this green drink, or I saw and I'm like, okay. Once again, you're coming to me, you're paying me, let me decide if we have this conversation, right? But I think that's just it. It's like it's starting with the family. It's starting with, I mean, certainly society as well and like their peers. But at home, if you're constantly on your phone comparing yourself to other people, or, I'm very conscious about what we say around my kids as far as bodies and foods. And I'm also conscious about like what the, grandparents and all of them say as well. I will literally stand up and be like, no, we don't say that in our house. It's not that we can't talk about fat. Fat is just a part of a body. It's when we start name calling ourselves, especially, right? They're watching everything. Like my son, he's 4, and he started saying like, oh, I'm just so tired. I can't do this today. And I was like, definitely heard that from me. Like they repeat everything, right? And so like if we're constantly body checking, if we're constantly, looking for the next latest and greatest diet, whatever, like they're going to do the same thing. They're going to model everything after us. Like where did they learn it from?
Same thing with overbooking your schedules.
Yeah.
Like I'm like, I have this day of nothing, and I have to like fight so hard to keep nothing on the schedule.
That's good, Heather. That's
try.
fucking hard.
It's so hard. Helps when you know it's 40 minutes to get anywhere though.
That's a good point.
That's it.
I'll hold you to
Free
it.
time.
When you got to trek through the woods for 20 and then drive 40,
uphill,
you know?
Kill a bear.
Take my buggy in.
Through a foot of snow.
Yeah, that's a good point. Yeah, that's what I struggle with, is just fucking, and having a kid has helped a ton, but just like, let's put the brakes on a little bit, take a breath, shut my brain off from work. But it's hard.
They really do force you to slow down.
Yes.
And for me, I don't have kids, but like it is sometimes hard to separate the work from like life, and that's why I personally am glad I don't live 5 minutes away from work. Like 20, I live in East Greenbush, so it's like 25 minutes for me to get home. The first 5 minutes is me literally running through everything that happened today. The next 5 minutes is like, okay, that happened. Could I have done anything different? And then the last like 15 minutes of my drive, I just have whatever music on, or if the Yankee game's on, I might have that on or whatever. And I'm just like trying to decompress that. And by the time I get home, I'm like, all right, I'm home, ready to go. Like sometimes I have to do a little bit of work afterwards. So I'm like, okay, I'll do this. But it doesn't feel like overwhelming to do it because I've kind of just decompressed myself from the day. And like, that's one thing. I don't know if I would want to live closer to work because that gives me that.
You would
I
have to
kids.
plan it in your day.
Yeah.
And I don't want to have to do that. It's built in. I don't have to plan
This is
it.
why I put a door on my office, because I live 5 seconds from where I work, aka my house.
In your home.
I put a door because I needed that like physical barrier to
Yeah.
like, we are done for the day, because it can be
Yeah.
a slippery slope. Of just
I would need
continuing
that if I
to-
Yeah,
worked
I
from
don't think
home.
I could.
100%. I need like a whole separate like garage or something for me to go to, because like that was one of the tough things. Was like when during COVID I would do online training, and like I'd get done with a session or like 3 or 4 sessions, and then I would just go right into like everything else work related, and then all of a sudden it's like 7 hours later and I'm like, I gotta like eat and go to bed, and I didn't work out today or whatever. Like I would definitely need a separate room with a
My
door and
nutrition
everything.
is so bad when I'm home.
Most people's are. I work with a lot of people who work from home.
So good when I'm working.
Yeah. Well, we get away from
Well,
good
because
and
you got
bad.
more
We-
structure. Yeah,
yeah.
you like plan ahead. You probably bring
Yeah.
things to work.
Yeah.
Yeah.
Yeah, a lot of
the
people
same
forget that. Well, I think there's this illusion of opportunity when you're at home. You're like, oh, the kitchen's right here. I can cook food whenever I want.
Right.
But most people are not going to just cook food whenever they want, because they're also going to have to do the chores around the house.
That's the
and
thing. It's the
laundry.
game you play.
Yeah.
I'll do the dishes and then I'll have lunch.
But you don't. You never do it.
But when I'm at work, I'm like, well, I have this 30-minute block to eat lunch.
And you packed your lunch.
yes.
We work on packing a lunch with a lot of my clients who work from home.
I pack my lunch every day.
Just as a strategy to prepare.
So that all you're doing, there's no, because this is the other thing we run into is decision fatigue. And when it comes to that, like most people, I think they say like by noon, like you've made hundreds of decisions, right? Whether it's like just putting on a pair of socks you're looking to like an actual important meeting. And so then to have to go feed yourself, like, are you really going to be able to make that decision? Probably not. And then if it requires cooking, forget it.
Yeah.
Like it's not going to happen. And like, I love to cook. I think all of us love to cook, but the last thing we're going to do if we're home and everything else needs to get done is probably cook ourselves a lunch.
Yeah, that's good. So if somebody, I guess let's talk a little bit to wrap it up just about the Unconventional Collaborative and what it is as a whole. Like if somebody is going to join, what are they getting? The team of you, the team of others?
How do they?
Well, they can Instagram message me at the Sassy Dietitian, or we also have an Instagram Unconventional Collaborative, unconventionalcollaborative.com. There is an application process because we don't really want like MLM Huns hunting down our
favorite thing
What's that? That's like the
like
the
the
isogenic
Arbonnes
shit.
and yeah.
Like, hey, girl, like, by
and,
myself.
yeah, and they're always like, hey, we have the same interests and the same background. I'm like, we do not.
Hey, lady.
What's MLM stand for? Multi-layered marketing? Is that MLM?
Multi-level marketing.
Multi-level
A lot
You
of
want
them
to
have
own
no-
your own business?
And I'm like,
They're like, oh my god,
actually,
yeah.
got
They're
one
like,
of
oh my god, we own it.
those.
I'm like, do you actually own your own business now? Because we could talk about.
I got one of those recently. I'm like, I actually own my own business.
like actually,
And I like it.
Thoroughly enjoy what I'm doing.
So there's an application process. I mean, we have trainers, we have health coaches, we have dietitians, personal trainer, or not, Jesus Christ, physical PTs. She's gonna kill me. Dentists.
I am also a personal trainer.
Yes, that's true. Yes.
I know when I applied, I was like, are they going to take me? There's no dentist. In this
Lactation.
They're going to
Yeah.
think it's so
We
weird.
have
Are there other
lactation,
dentists now, or
midwives.
is it just
me.
you, Kristen?
Yes.
Julia.
Julia.
Oh, Julia.
Shout out to Julia.
Pediatrics, yeah.
Yeah.
We have a ton of dietitians, physician assistants,
Mental health.
midwives. We have therapists. really runs a gamut, which is so cool because everyone's coming at it from a different angle. So it's an application process, kind of tell us all about you and what you do and your background and, you know, what you're looking for. Because we also want people who are committed to actually collaborating, right? Because if you're not really there yet, like it's not going to benefit you or the people surrounding you. And so it's a month-to-month service. It's a membership, and online there's a chat. We also do guest lectures 1 to 2 times a month. We do a Collab and Connect call where we just hop on a Zoom and we talk about whatever, wherever it goes. There's tons of protocols. We just dropped a 45-page amenorrhea guide to kind of help people in their practice understand it and then how to apply it and, you know, make changes. Lots of resources. And then people like these people who are just like a wealth of knowledge. Like I always say, I feel like I'm the dumbest person in the room most of the time I'm there, which is how you learn. Like you don't learn if you're not around people who know more than you.
It's a forum. You can go post anything. So you have a client or a patient that you're struggling with or you're not struggling with, but like a lot of times this happens. Like I know orthopedically where I'm going to go with this patient, but then there's all these other, like, because I ask a lot of sleep, diet, medication, mental health questions, but I don't understand them. So I'll put them in there and then everybody can kind of chime into that. But also we've had business conversations. Like you've asked about like discovery calls and or like how are you utilizing ChatGPT? Like there's like business kind of help coaching stuff too.
And because it's easy to feel like you're in a silo sometimes running your business because you're just like doing all your day-to-day tasks. It's hard to step out. Maybe they're just between your family and work. There's not time to ask for help. You don't have the space to ask for help.
That's one of the things I miss about being a part of a huge clinic is that like you're leaving your patient and you're like, hey, this happened, or like a gym like this was so much fun to work in a place like that. You're like, yo, Mike, come over here. Like, what do you think about how this knee is moving? You know, and then you can like chime in and you just like, that is kind of what this is, but virtually on the internet.
Yeah, I think that's big. And you feel like you've all applied things many times just from
taking,
talking, learning,
and
applying.
leaving.
Yeah. I feel like we can help people so much better because we see things we didn't like. You're blind to things you don't know about, right? And then once you know about something, you're like, oh my gosh, there's a thing we could do for that. Let me send you over to Heather. Like you learn more and you can help people better.
Like chronic UTIs.
Yeah, like I had no idea that a chronic UTI could be
pelvic floor dysfunction.
Exactly. Like it's amazing how much I've helped clients because of all of these people. And usually it's nothing that I'm doing except saying this qualifies you. You need to go see a pelvic floor PT. You need to go see an airway dentist. Like, and here's how. Because that's the other step is like, you might know, but then it's like, okay, but how? Yeah. So like, you know, Kristen has explained exactly how to go get a sleep study. I've actually done it myself. And Heather has said like, I'll go post in my PT community and ask for someone who's local to your person. Like, it's just amazing how much all these women have just like, there's no, fixed mindset. It's abundant. You know, there's probably like 10 to 12 dietitians in there alone, and none of us are scared because like all of us can help a different variety of people, and there's
more than enough people who need
help. More than enough. More than enough.
That's for sure.
Did you mean for it to be all women, or is that just how?
No, we didn't.
I was wondering about that. Yeah.
No. I mean, I think it makes sense because both Danielle and I are in the women's health space, and women's health tends to lean more towards female dominant practitioners, but. No, I mean, we've had a few men inquire, and then I think they're almost scared when they're like, oh, it's all women. I'm like,
that's real. In high school, I was in a Spanish class, and I was the only guy, and I went in first day, and I go, what the fuck? And then I asked to, like, get out, and they were like, no, like, why are you getting out? And I was like, the only guy. And I'm just like, fucking, like, stay in there, dude.
Suck it up, Mike.
Yeah, hung in there. It was great. So that's real. But no, yeah, just having a place to go. What are, I guess we'll finish with this. What are, like, common things you hear from women in terms of I guess in all your practices, like feeling like they just haven't gotten the care that they needed in whether it's PT, whether it's seeing other dietitians, whether it's seeing other dentists?
Literally, they come in and I say, what brings you here today? And like 99% of them will just start crying because nobody asks them.
Yes.
That's all it takes. It's just you're holding this big space for them to just be them and share their story.
I feel like that reminds me of when I was in New York City. I had a client, and when we did it was called a fitness orientation, but a strategy session, evaluation. You know, I'd sit down with them for, you know, anywhere from 10 to 20 minutes because I had an hour. So I'd be like 10 to 20 minutes. I try to block that out so that way I could actually do some actual physical things out on the floor, so they would get an idea of how I coach. And I spent an hour with a girl just in my office, and she was with me the entire time. I was in New York twice a week because she had a huge anxiety for the gym, and she literally had a nightmare the night before she came in.
Oh.
And I was like, all right, well, we're gonna sit here and talk,
She had
and
someone
we're
to
gonna
listen.
and we're gonna figure this out. And like, she's
We call this trauma-informed care.
Oh, well, I didn't know that. Well,
Like,
there we go.
actually
See? I
listening
did
and
that.
holding space
Yeah,
for people.
it's amazing.
So like that was one thing. Like that person and everything like sticks in my. And I like she lives in Jersey, but like still check in with her every once in a while, see how she's doing, and like she got married recently and whatnot. So it was like it's really cool to be able to help somebody on the mental side and then see the change on the physical
Well, you don't
side,
realize
too.
that we're all getting into. We're all like, I didn't know I was getting into the psychology field until I started doing this.
Yeah.
Every day we talk about how I'm like, I basically feel like a therapist.
Yes.
You should see the
We
things
are.
people dump on you when they're in the dental chair. I know everything about it. It just comes out. And I'm like, oh God, I don't even know what to say to that.
But part of that, you are building trust, you are building
Yeah.
relationship. It's opening up this window or this space where now you can really help somebody.
Well, think about that hour you spent with her, the ripple effect that probably had on the rest of her life.
Yep.
And it didn't hurt you at all.
No, and I was like, and by the time we got done, I literally was like, oh shit. I was like, we didn't even go out to work out. She's like, that's fine. I'm gonna sign up. I was like, oh,
If
okay.
now she's comfortable and yeah.
I was
Well, I
like,
think it's sad too because there are bad trainers, there are bad dietitians and dentists and PTs, like, right? And so I think a lot of people also have these preconceived notions of maybe not bad ones, but ones who weren't trauma informed or weren't like taking that extra time, like you said, to ask these questions and listen, and instead just throw things at them, right? Like, I mean, I'm guilty. I'm sure when I was 23, new to nutrition, I'm like, you got to do all of this, right? And
Yeah.
now it's like exactly what you do. Like I ask, I'm like, why are you here?
Right.
What do you want out of this? And sometimes they don't know. Sometimes they're like, I'm tired and my friend sent me here, and then the water works because they've tried everything.
Oh,
and-
but so many. I don't know why I'm crying.
yes.
Yeah.
So many of that.
Yes.
Like,
Or
yeah,
I'm
you're-
sorry I'm
you're
crying. I'm like,
'cause
don't
you're-
apologize.
It means a lot.
Yeah.
Well,
You want to feel better, right? I think that's probably why. I mean, I know that's why they come to me. They just want to feel better. Sometimes they don't know why, and they're just like, I just want to feel better in my body, and I don't know how. And I've been told that my labs are normal, and like I'm at a crossroad of what else do I do?
Right. Well, and I think that's one of the things I always ask too when I would have, because in here we get a mix of adults and kids, and you know I'll always ask, especially with adults, like when I was in the city or here, it was like, have you ever worked with a trainer before? Because I want to know what your preconceived notions
Yes.
are. And then I always ask them like, well, what did you like and what didn't you like? You know, like because I want to know what you liked because I want to double down on that, and what you didn't like, I'm never gonna do.
Yeah. And I feel like too, right, Paul, like we are a bunch of dudes in here, and I feel like we do a great job with women and high school females, but yeah, you have to kind of knock down that preconceived notion because a bunch of us dudes, fucking beards, tattoos, right? But
Yep.
it's just like, okay, like let's talk, let's listen to you, so you know this is a safe space.
And a lot of, I mean, we've talked about this. A lot of our female athletes actually prefer male coaches to their female coaches, for whatever reason. It could be a million different things.
Because women are mean.
That's one of the big
yes.
ones.
Yes.
Not any of us.
But like, and then they get like a good female, and they're like, oh my god, I love her. She's amazing. Like, we have a PT we've sent like some people, a lot of people to, and like every single one of them loves her. Every single girl that goes through loves her. But it's interesting because like obviously with adult females, there's a little bit different, and you get into sometimes like conversations that you're like, oh, shit, I don't really. But having, you know, the resources to go, oh, I can send you to Laura or Heather or Kristen, or send you to the whole collaborative, and they can figure out exactly what's going on, and
do that a
then
lot.
come back
Yeah.
and we can.
I have
use that
friends
to
say,
kinda-
hey, can you post this in the collaborative for me? And I'm like, sure.
I literally offer that to patients. I'm like, I have literally no idea, but
Yeah.
if you want to send me a list, I'll just pop it in there and somebody will know something.
Yeah, I think that's great. Yeah, Laura, if you want to just plug anything, where to find the collaborative, and
Unconventionalcollaborative.com, but don't skimp on following these two as
and
well.
yeah, and Heather plug and Kristen plug.
I'm Fern PT.
I'm Prana with Dr. Kristen.
Boom, perfect. Well,
Awesome.
thank you for doing this. I apprciate it.
Thanks for having me.
Yeah,
It
thank
was
you.
great. Thank you.
Thanks.
Take care of Jordan's tongue tie right now.
Yeah.
Oh, yeah, check it out. Oh my God.
Boom. We'll catch
Wait, I
up
want to
next
see
time.
this too. Let's
Thank you.